Hi everyone, and welcome to episode 4 of Ask a Biller. I'm Dylan, the medical billing specialist for Smart Billing Pro here at SimplePractice.
And I'm Maggie. I'm an insurance specialist here at SimplePractice. Today we will be discussing client payment types. We will go over deductibles, coinsurance, copays, and out-of-pocket maximums. Following this video, we will host a live event to answer your questions about client payment types.
And remember that if you have questions specific to insurance features in SimplePractice, we offer a class every Tuesday at 11 a.m. Pacific Standard Time and Thursday at 3 p.m. Pacific Standard Time to walk you through getting started.
We've been getting a ton of questions about this particular topic, so we're going to start by simply going over some terms, and then we're going to address some more specific questions that our customers have had.
The first that we were going to cover is the type of plan your client has and how to interpret what's listed on their ID card. This will help you understand how you're going to manage your client's payments.
So verification of benefits is still super important, but at first glance, your client's ID card can tell you a lot of information. First, the ID card should have the plan type listed on it. The plan type will inform you whether or not your client is eligible for out-of-network coverage.
With plan types, there's a lot of acronyms to decode. The most common plan types are PPO, which stands for Preferred Provider Organization. Clients can see in-network or out-of-network. They have flexibility to choose whatever provider they want to see. Then next we have HMO, which is Health Maintenance Organizations. Here clients can only see providers that are in-network, and it is required to have an assigned PCP or primary care physician for all your referrals. Referrals may or may not be required for behavioral health.
A POS plan is a point of service. So like an HMO, in that they have to have an assigned primary care physician and that they need referrals, but they can see providers that are out of network. And an EPO, or an exclusive provider organization, is where they can only see doctors that are in network, but they don't need referrals, and it's not required to have an assigned primary care doctor.
Okay, your client's ID card may also help you determine whether or not your client has a copay for office visits. Every ID card is different, so there's no standard you can expect, but many will have a small summary of their coverage.
On this card, preventative indicates that there's no copay for medical services that are considered preventative. So annual checkup, annual lab work, mammogram, etc. ER equals emergency room, and OV stands for office visits. You never want to just go off what is on the card. You always want to verify coverage based on the CPT codes that you're going to be providing, but this is a great place to start.
Other language that you can expect to see on the client's ID card are shown on this slide. So the most notable here are PCP, which is primary care provider, COIN stands for coinsurance, DED for deductible. HDHP is high deductible health plans, and there will be some additional acronyms on there for pharmacies as well.
Now let's get into the different payment types you can expect to see. We are going to be covering in-network examples. These scenarios will apply to the payers that you are paneled with. The first and easiest one to understand is copays. So a copay is basically a cover charge to get in to see a provider. This will cover the charge for the office visit, but might not cover additional services provided during the appointment. If there's any kind of additional testing or you bill other services, it will be a separate charge that a copay might not cover. They're generally broken down by specialist or primary care. Primary care usually being a cheaper option, and a copay you will want to collect at the time of visit and then bill the insurance your entire private fee.
And for an example, let's say your session fee is $100 and your contracted rate is $90. You checked with the payer and the client has a $40 copay. So you would collect the $40 up front, and then you would bill the full $100 fee to the insurance. They will then reimburse you the additional $50 to total $90, and you'll write off the final $10.
The next payment type to consider is deductibles.
A deductible is a set amount that your client pays out of pocket towards all their services. They will have to meet this amount first before the insurance kicks in. Copays generally do not go towards a deductible, and it's very important to know what your contracted rate is so that you know what to charge your client. Payers generally won't share this information with your client So clients with a deductible usually have no idea what they are going to have to pay for a particular service when they're walking in the door. It's also important to remember that deductibles do not roll over at the end of the year.
So let's say, for example, your client has a $1,500 deductible. Your session fee is $100 and your contracted rate is $90. The client will pay you $90 directly. You will submit a claim for the full $100 to the payer, and the insurance payer will keep track of the services and not the actual payments. You are responsible for making sure that the fees are collected, and you are going to write off $10. So this is how billing this client will work until they've accumulated a total of $1,500 worth of services. Then coinsurance will kick in. And coinsurance is the predetermined percentage that the client will owe.
Okay, for example, your session fee is $100 and you know your contracted rate is $90. The client already met their full $1,500 deductible and the payer told you that their coinsurance is 80/20. This means that the client will owe you $18, which is 20% of the contracted rate. And the payer will then reimburse you $72, which is 80% of the contracted rate. And again, you're going to write off that final $10. All right, everyone, and back by popular demand, Charlie is here to help you understand the different payment methods your client might throw your way.
Shoot, 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 whoa, shoot, 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 whoa, shoot.
Hi there, Charlie here. Every time Charlie Chats rolls around, we decipher another item in the odd language of insurancese. This week on Charlie's Chats, we're going to talk about health savings accounts, flexible spending accounts, and health reimbursement accounts, aka HSA, FSA, and HRA. What do these acronyms mean, and why do you need to know about them? Well, these are all different types of payment methods offered by employers and payers in an effort to curb the cost of spending on healthcare. These accounts usually complement plans with high deductibles, where the client would have to pay a considerable amount out of pocket. First, let's talk about the HSA. A health savings account is essentially a debit card for healthcare expenses. Your client and their employer may contribute pre-tax money into this account to go towards qualifying care-related expenses. Only certain types of coverage allow supplemental HSA. Your client should have a card for their HSA, and they will have ownership over this account. It will not be directly connected to the payer they're covered by. It is entirely supplemental to their benefits. You'll charge this card just like you would a debit or credit card. You can use SimplePractice's super convenient payment method, Stripe. Next, FSAs. Flexible spend accounts are owned by the client's employer, but are held in the client's name, and both parties can contribute pre-tax dollars to the account. Ownership is what distinguishes this type of account from an HSA. There's also more flexibility about the type of coverage a client can have. The plan doesn't have to meet specific qualifications, but the expenses must be health-related. FSA vendors will have a list of applicable expenses, and your client should have an FSA card that can be charged in Stripe as well. Last but not least, the HSA, a health reimbursement account, is different from the first two in that your client won't have a card that they can charge services to. The account generally must be integrated with the client's insurer, and reimbursements will be issued only after services have been billed and processed. The account will be held in the client's name, but deposits into this account are made only by the client's employer. Clients may need to submit invoices and EOBs to their Human Resources Department in order to be reimbursed for out-of-pocket expenses. Now, I know this is a lot of information, so if you need a refresh, head to our blog, where we've provided a downloadable list with everything you need to know about HSA, FSA, and HRA. I hope that makes the insurance part of your practice a bit simpler. So until the next Charlie Chats, here's Maggie and Dylan.
All right, thanks for clearing that up, Charlie. The last element of payment types that we're going to cover is the out-of-pocket maximum.
And for once, guys, this is exactly what it sounds like. Every benefit plan will have an absolute out-of-pocket max that the client will have to spend of their own money. Out-of-pocket max amounts can vary a ton depending on the client's coverage. In-network copays, deductibles, and coinsurance payments all go towards this network out-of-pocket max.
And on this topic, Cheryl from our Facebook community added that she had some trouble with
knowing when a client has met their out-of-pocket maximum. I've had this happen a few times, and the only way I found out was when reimbursement went to my full contracted rate. By the time that happened, my client had paid sometimes up to 4 copays they didn't need to pay, and I've had to refund those funds.
Cheryl, that's a great point, and I'm sure a lot of our customers have the same concern. So since you might not be privy to the other healthcare expenses your client is accumulating, the best way to keep track of this will be by checking the client's benefits before you start treatment. That way, you'll have an idea of where the client is or how much they've met of their out-of-pocket max or deductible for the year.
And here's a little smart billing pro tip. We also recommend periodically checking in with the payer if this is a client that you'll have a long-term treatment plan with. We can't guarantee that this won't happen, but if the payer has an online portal, it's good to keep track of this info and keep record of it in your client's overview in SimplePractice.
And we had another question from Maria regarding a Kaiser deductible.
I don't understand why Kaiser deductibles show up as denied. I was told it's a clearinghouse issue and that it's being worked on, but as a therapist, I like to understand the rationale behind things.
Maria, this is a great question, and I can definitely appreciate that a lot of our customers are concerned about this as well. What happens when you see a denial status that should say deductible is that our automated system is interpreting a $0 payment from the payer as a denial, when it's actually a $0 payment because the client owes you their deductible. When this happens, you will need to go through and add the write-off amount for each session so that the full session fee is accounted for. And then the system will recognize that this is a deductible and the status will update automatically.
All right, everyone, that's all we have for you today. Thanks so much for tuning in. And if there's anything that you still have questions about regarding client payments, don't worry, we'll be hosting a live event 2 weeks from now on May 17th. We'll be sharing the link to register for that webinar right here on our blog.
And remember, if you have questions about your SimplePractice account, we offer a bunch of resources and live classes to help you out. To sign up for a class, go to support.simplepractice.com, and while you're there, take a look at some of the videos and guides that we've put together to make using our software a breeze. Also, if you like the shirt that I'm wearing and want to get one for yourself, check out our SimplePractice swag shop at this link. There are plenty of other great items for your friends and family. And the best part about it is that all proceeds go towards Ocean Park Community Center, a nonprofit organization headquartered here in our home of Santa Monica. All right, that's all we have for you today. Thank you so much for joining us. And until next time, keep it simple.